Hello, I'm Dr. Rohit Lamba. I'm a consultant orthopedic surgeon working at Birla Hospital, Gurgaon. Today we're going to discuss a few things about home care and its scope in the field of orthopedics, what we do with it, how it can help our patients. So a lot of things which the patients don't know how to manage once they're discharged from the hospital can be managed and can be put under the purview of home care. There are a lot of companies right now who are coming into this field and working big time into it because everyone has recognized the need of providing that filling up that gap that was there in the healthcare sector earlier. So what usually happened was the patient got a good care in the hospital, got a good surgery, there was a proper rehab plan and everything was done. But as soon as the patient went home, he lost the care because the family members are not able to take care of the patient, and there are some special needs for some patients who are bedbound and require some specialized medical therapy, and in some cases they do need some equipments as well as needing physiotherapy as in the case of orthopedics. So all of this was really difficult to be managed only by the relatives at home. So this is where the home care home care ecosystem has come into being and has helped the patient big time. What usually comes into the purview of that is starting from the treatment that the patient is supposed to be taking, the medicines that are supposed to be given, at what time, at what interval, and then in some cases some patients need some injectables, they might be antibiotics or some other things. So you need taking care of that as a trained nurse who can give an intravenous or an intramuscular injection and take care of the other medical needs. Then some patients who are elderly and or maybe they may be bedbound because of some fracture or some other issues, they need some specialized care in the form of a caregiver who can get the patient to get up, to sit up, and if possible maybe walk out of the bed, walk to the washroom. Like in the case of our patients who have been operated, they might need a change of dressing if it has become soiled, or in patients who have a urinary catheter, that needs to be taken care of, cleaned and maintained, hygiene maintained for that case. And in some very rare cases, if there is an emergency, that patient has suddenly developed a complication or something, then they need to be taken care of, they need to be looked at by a registered medical nurse who can actually do a normal survey and then examine and then find out what the real cause of problem is, and then if need be sometimes if some therapy can be given right at the spot, they give it at home only, and if the patient needs to be transferred to the hospital, they do it at the earliest. So all of these things and a lot more has been coming under the purview of home care management, which has been taken care of many agencies. One such agency I know of is Dr. Dixit, who is in this field for many years now. He has an experience of having worked with the best hospitals across Delhi NCR, and he's got the skills to know what to do and when to do. So his team along with the clinicians, we coordinate together to give the best possible care of patient at home.